And here is your question number 15. Schematic illustration of carotid pulse is provided below. What is the diagnosis? And this is simple and extremely straightforward. The right answer is the normal pulse tracing. Remember, the normal pulse waveform will be catacrotic in nature, right? And you're going to have a systolic peak and then a dicrotic notch. Presence of dicrotic notch indicates closure of aortic valve. Okay, that's what is indicated by your dicrotic notch. And also, it's going to be indicative of that elastic recoil of the aorta. Fine, whatever it is. The same pulse tracing can be seen in the pulmonary artery also, but you need a pulmonary artery catheter for that. But in carotid tracing, you're going to see all these changes because of recoil of the aorta and closure of aortic valve. And you have a systolic phase and a diastolic phase as well. So this is a completely normal tracing. It's catacrotic in nature. It's a normal tracing. What you'll see in aortic stenosis, you can see a prominent anacrotic notch, which is otherwise not prominently seen in normal individuals. But in aortic stenosis, you will see a prominent anacrotic notch somewhere in this area, and it'll be a early anacrotic notch as well. And of course, you will be seeing a characteristic form of pulses called as pulsus parvus et tardus, which is nothing but a delayed peak but a sustained peak. Okay, so that's a very characteristic finding of aortic stenosis. And what you will see in aortic regurgitation hypertrophic cardiomyopathy, you will see something called as pulsus bispherians, which will have two systolic peaks. Something like this. This is a typical example of a pulsus bispherians. Okay, you're having two systolic peaks. And then, of course, you'll have a dicrotic notch as well, but two systolic peaks means it's pulsus bispherians generally. Some people tell that anacrotic pulse is also kind of pulse that will have two systolic peaks, but nevertheless, whenever you have two systolic peaks like this, it's very much indicative of pulsus bispherians. So what are the causes of pulsus bispherians? Number one is going to be your hypertrophic cardiomyopathy. Number two, severe aortic regurgitation. And number three, AS and AR together, which very commonly happens in the setting of bicuspid aortic valve. But remember that severe AS will not cause pulsus bispherians, rather it will cause pulsus parvus et tardus.